Okay. Instagram, we are live. Facebook, we are live. Awesome. Okay. Good morning, everyone. Happy Tuesday. Happy Clinical Tuesday. You are here watching the PT on Ice Daily Show brought to you by the Institute of Clinical Excellence. My name is Julie Brower, and currently I am serving as a TA for the Modern Management of the Older Adult Division. And that is with our awesome lead faculty, Dustin Jones and Christina Previtt. So quick announcement there, our next online cohort starts January 6th, and that is an 8-week course. It's super interactive. Every other week, there's an hour-long live meetup, and we really dive into a lot of the Jerry PT research, and we go over case studies. It's a total blast. So whether you are in acute care, home health, inpatient rehab, skilled nursing facility, outpatient, or a fitness facility, this class is totally applicable to you. So if you have any questions whatsoever, feel free to reach out. I'd be happy to answer any questions that you have. So before we dive into this topic today, this is my first time on the PT on Ice show. So I'm super excited, and probably a lot of you have never interacted with me whatsoever. So just to give you a quick background, so I am a PT in Charlotte, North Carolina. I've been practicing here for about 5 years. I'm primarily in the acute care and inpatient rehab settings, and then I also work with a more athletic population inside of a gym. And I absolutely love to mesh those two worlds together. I love to treat the sickest of the sick to the fittest of the fit, and I love to bring more of a higher intensity fitness athlete approach to my medically complex patients in the hospital. So our topic today is a fitness forward approach to low back pain in acute care. So typically when we think about treating low back pain, we think about treating this in the outpatient setting, right? Like, we can think of a typical patient avatar there. Maybe it's a patient who had a lumbar fusion surgery a couple years ago and they're coming in because they're having return of symptoms. Or maybe it's a patient who didn't have surgery whatsoever. They have non-specific low back pain, and they're coming in with their MRI and their X-ray, and they're being told they have degenerative disc disease. And, you know, we could be their last-ditch effort before they consider surgery. So with both of these patients, you know, as fitness-forward clinicians, we could be the first ones in an outpatient setting that are introducing them to load. Some of these folks have probably never squatted or deadlifted before. A lot of times, you know, they know TheraBand exercises, they know low-level motor control, and hamstring stretches. And we could be really the first ones that are loading them up and talking about stress reduction and the importance of sleep and the importance of nutrition, and with the goal of really trying to move someone from sickness or relative sickness. If you guys listened to Fitness Athlete Friday with Zach Long last week, he talked about how in the outpatient world, you can think about sickness as, you know, their tissues are sick. So we can think of low back pain, the tissues there are sick, and we're trying to move them from sickness to wellness to fitness. And that's the goal. And our outpatient colleagues work really hard at this every single day to inspire behavior change and change mindset and really start to chip away at nocebo language. And, you know, this isn't easy. And I am here to preach that as acute care PTs, we can really help set up our patients and our outpatient colleagues up for success. You know, if we come at our patients in the hospital with a fitness forward approach, then they can end up being the ones that walk into our outpatient clinics. One, they're seeking PT first before anybody else. And two, they already have the expectation that they're going to get better. And what we know is that expectations drive outcomes. So there is no better time than when our patients are actually all the way at the beginning of the spectrum. They're actually really sick, not relatively sick, very actually systemically sick, to inspire them to take control of their health, to introduce them to intensity and load, and really set them down the path from sickness to wellness to fitness. You know, we really should be speaking the same language and sending that same message so that we set our patients up for success. And the problem is that I really don't think, with how routine PT is done in the hospital, I don't think we can accomplish that goal easily, at least. Because if, you know, let's think about how routine PT goes in the hospital setting. And I'll kind of give like two examples. So one, we can have like our post-op lumbar surgery patient. And then two, we can have our patient who is in the hospital for some other reason, but they reveal to us that they're having a difficult time with meaningful activity because they have low back pain. So let's talk about our post-op, we'll say a post-op lumbar fusion surgery patient. What does routine PT look like? You go in the room, you know, the first thing you do is talk about your restrictions. We talk about our no bending, lifting, twisting, and say it's like the sandwich, it's a BLT. These are things that you don't want to do. We teach them log roll, we get them up, we maybe take them to the bathroom, they walk in their room, maybe we get them into the hallway, and perhaps we give them that like archaic handout of HEP exercises, which are ankle pumps, glute squeezes, heel raises, and that's it. We sign up, we send them on their way. We can think about another patient who is in the hospital for some other reason and tells us, you know, that they have a hard time doing meaningful activities because they have low back pain, but because their hospital admission is, hey Dustin, what's up? Because their hospital admission is unrelated, we're not even going to address it, right? We're going to blow past it because we just consider our role to figure out a discharge recommendation and move on, and that's it. You know, I remember when I was on the spine floor, when I first came out of PT school, my productivity was amazing, right? Because, you know, you go in, you see these lumbar fusion patients, it's plug and play, it's the same script every time, in and out, and that was it. And guys, like that's not it. These patients in the hospital, they are sick, they are vulnerable. There is no better time for us to seriously take a fitness forward approach and introduce load and intensity and inspire them to take control of their health. You know, we need to give them more than ankle pumps and glute squeezes to get out there and be able to withstand medical stressors. I mean, there is a pandemic going on in the world right now, and we're going to give people ankle pumps and glute squeezes. Like, we're not going to talk about exercise and sleep and nutrition. Like, that is not how to play offense, right? I mean, we need to seize the opportunity that we have when we're with these patients. I mean, literally, we have a captive audience. I mean, unfortunately, they're literally like held captive in their hospital room. Like, now is the time to create that change so that, again, when we send them down the right path and they walk into the outpatient clinic, they are already in the mindset that they're going to get better. This is what we can do in this setting. You know, like, if we want to be seen as doing more than walking patients, like, for the love, like, let's do more than walk patients, right? Like, acute care version 2.0 has to look different. And so what does that look like? So let's take our post-op lumbar fusion patient, okay? How does it look different? Day one of surgery, day one after surgery, we need to start getting these patients hinging and loading right away. Yes, day one. So many times we just focus on what they shouldn't do And all we're doing is inducing more fear into our patients, right? How many patients have we seen that we go in to eval them and they are so terrified to move because they think they're going to break their hardware if they bend at all? You know, we need to get them out of this fear mindset, right? Because we know that fear can decrease quality of life, decrease performance, and especially in our older adults, it can increase fall risk, right? So instead of focusing on movements that they can't do or they shouldn't do, we need to be focusing on movements that they can do. So right away, I'm not focusing on the restrictions. I'm getting them up and I'm getting them hinging. So what does that look like? So a really awesome acute care hack that I do all the time is I go and get a bunch of towels and I soak them with water, right? So soaking wet towels rolled up equal load. And this is, you know, sometimes I do carry weights in my backpack and TheraBands, and it's awesome because it feels like I'm like rucksacking around the hospital. Like, might as well be working on my own fitness while I'm working. But a lot of us I know in our systems do not have weight. So do not have dumbbells or anything like that. So I will soak up a bunch of towels, I roll them up, and I put them in the toiletry bucket that patients have in their rooms, and I put it on a chair so it's an elevated surface, and I'm teaching them the right way to hinge. And right then and there, they're already starting to lift a little bit of load. And then we can go over correct squat mechanics. I mean, in reality, these people have to get in and out of bed. They have to sit down on the toilet, in and out of a chair. Functionally, this is so important, and why not teach them proper mechanics now? Most of the time, these patients that I see who have surgery, I ask all of them, did you do PT beforehand? Do you know what a deadlift is? Do you know what a squat is? They have absolutely no idea, the majority of them. So the time is now, day one, to teach that. So another thing that I do all the time in a fitness forward approach is I am preaching about sleep and nutrition and stress reduction. I mean, let's just talk about sleep and pain, right? So we learn in the ICE Physio course, in the cervical and lumbar management courses, the importance of sleep and pain. You know, chronic sleep deprivation can cause abnormal pain processing. So why don't we spend some time when we're with these patients to give them some strategies about better sleep? Talk to them about putting the temperature down to incredibly cold, or stopping drinking caffeine early in the day. That's one I'm still working on personally every day. But, you know, we need to start giving these people some ideas on how to increase their capacity, especially while they're recovering from surgery. And the next thing that I do, which is, you know, the most fun, is that, you know, it's time to work out. Like, it is time to dose the meds and play some offense. So if my patient does not have any contraindications to exercise, and we have really good resources to guide us in that, then I'm going to grab a vitals machine and we are going to go through a workout. So how do I do that? I mean, I game plan that with my patient. Like, we do it together. And so I'm asking them, like, what's meaningful to you? If you are not sick, if you are not in pain, what is something that you would do? What would bring you joy? And they're going to give me some meaningful activity. You know, most recently I had a patient who said that she didn't have the balance to get down on the ground and while her granddaughter came over to hug her. And she didn't have the strength to lift her granddaughter. So I'm going to program something that includes balance. We're going to get some deadlifting in, and we're going to get some squatting in. And then I usually will use my phone or their phone, and we put on some music. I mean, the amount of times I've listened to, like, the Eagles' greatest hits and Queen's greatest hits, I can't even count. But it's awesome. It's fun. It puts them in a different mindset. And this is introducing them to load. It's introducing them to intensity. You know, we're educating them about the RPE scale. We're getting them to feel that they're strong. They're sick, but they're strong. They are capable. We are showing them firsthand that we can bring meaningful change to their life, right? And that, you know, that is what it's all about. We're showing them what not crappy PT looks like. They're getting a dose of it. I love a duffel bag deadlift. So a lot of my patients, they'll have suitcases in the room. They'll have bags all over the place. I go around and I just load up everything I possibly can into their own, suitcase or their bag, and that's what I have them deadlift with. Again, if I don't have any weights or anything with me. And, at that point, when they literally are like, hey, I need a new hospital gown because mine's sweaty now. Like, that is such a beautiful thing. Like, I have to get a new gown for my patient because they were sweating and they need a new one. Telling patients at this point that stronger people are harder to kill, it means so much to them, because these patients, a lot of our patients in the hospital, they have just escaped death closely, right? And so we're giving them that feeling of what it's like to be resilient, even alongside of pain, even alongside of sickness. And so as we're doing this, and they're shocked at what they're capable of in this state, that if we do a really good job at that, then the next part of selling PT becomes really easy, right? Like, we can then say to them, like, I want you to start with outpatient PT or home health PT, because I want you to carry this through. I want you to get started on an appropriately dosed strength and conditioning program and keep progressing from what we did today. And they're gonna understand. Now they know what it feels like, and they're gonna be like, yeah, I agree with you. I think that's really important, what I need to do. And does this work with every patient? No. Obviously, there are going to be patients in the hospital that this is not going to be appropriate for. But the more you guys attempt, the more you find those perfectly matched individuals that you are going to be able to significantly change the trajectory of their lives. And by putting them through a workout and getting them to feel that, they now know, again, I said it before, they now know what non-crappy PT is like. They now know what excellent PT is like. You're giving them the tools to advocate for themselves, so that when they leave you, because it's hard in acute care, we don't follow our patients, right? So it's hard to know what type of provider they're going to come to next. And if we give them the tools and they know what excellence is, then they can advocate for that and know if they are being underdosed. Imagine that our patient literally says to their PT, this is not challenging enough for me. I know what the intensity is I should be working at, and this is not it. Can you ramp this up for me? Like, that's amazing. Like, empower our patients. And, the last thing that I typically do with patients is, I will sit them down and I will bring up Onward Charlotte. I will show them a fitness forward clinic. I will talk about Zach Long. I will talk about Jordan Berry. I will bring up Stronger Life HQ with Dustin, Jones, and Jeff, and I will show them what they have older adults doing, amazing things, lifting really heavy weight off the floor. I will bring up Stave Off, and I'll show them Christina's athletes, and they're just so amazed that they're looking at people their age that are doing these amazing physical things. And they'll say, like, I feel really inspired now. Like, thank you. And that is what it's about, guys. Like, that is acute care PT 2.0. That is how we inspire patients to take control of their health, set them down a path from sickness to wellness to fitness, so they never come back on our caseload ever again, right? We are sending them straight to an Alex Germano in home health, and we are sending them straight to an Onward or a Stronger Life HQ. Like, that is how we can seriously change people's lives, even when they are the sickest of the sick. So hopefully, you guys who are in those settings, do something different today with your patients. I would love to hear if you attempted or you were successful at being able to implement any of these strategies or have these discussions or education points with patients. Please let me know any questions or comments you have. Please go ahead and start a discussion. I would love to chat with you guys about it. And for all of you guys who are out there working around the holidays, I know this is a tough time for healthcare workers and for patients. A lot of times we can get our patients home for the holidays, which revel in that joy with your patients. And unfortunately, a lot of people become sick around that time, and they won't be able to be around their families. As healthcare workers, we won't be able to be around our families. So you guys are my heroes, and be really kind to yourselves, and give yourself a lot of grace so that you can continue to support our patients and give them a lot of love through the holidays. And with that is all. You guys have an awesome rest of your Tuesday, and we'll talk again soon.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.